All right, good afternoon, everybody. Simon Hoehn with Aptiva Health. I'm the Director of Therapy here, and we are super excited to introduce you to Jared Simpson. He is our Director of our Concussion and Vestibular Therapy here at Aptiva Health, and we're really just excited to get to know him a little bit and share all that he does for our team at Aptiva. We've seen a lot of great growth and success with our concussion department, and Jared has been a big piece of that. So, Jared, thanks for joining us this morning, man.
Thanks for having me, Simon. It's good to be here. It's been a really exciting time the last couple of years since I've been with the company. It's really grown into, when we had our conversations back in 2022, when we had the vision for what this department, what this company could be, seeing everything come to fruition has been a really cool process to be a part of. So just happy to be here and ready to keep rolling.
Awesome. Well, we appreciate you, man. You're doing a lot of cutting edge things in the vestibular therapy world and the post-concussive world. So before we dive into that, why don't you just give us a quick background on who you are, where you went to school, where you're from, and what led you to Aptiva?
Yeah, sure thing. So I graduated from Bellarmine in 2020, did outpatient ortho. It's something I went into grad school. I always kind of knew that was the end game for me, but I didn't realize I could take it so much different places. Again, when we met back in 2022, you talked about the possibility of concussion care coming to the city of Louisville. My background, I've always worked with sports injuries, but never really concussion specifically. So I saw it as a great opportunity for me to really grow my skill set. And since coming over a few years ago, learning from the greats like Dr. Mandarino and going through my vestibular course, it's really grown to a strong team we have here that we've been able to build up.
Yeah, that's awesome. You mentioned Dr. Lisa Mandarino, and she is our neuropsychologist, one of 35 fellows in the entire United States and world even that have her specific certification in concussion. So I know having her here sort of quarterbacking this vestibular piece on the concussion side has been really helpful. Tell us a little bit about what it's like for a patient when they come in to Aptiva. Like what can they expect here? What's that process? They get a concussion, they hear about us, they come see us. What happens through that process?
So I think from a patient's perspective, I feel like they're getting streamlined in a process that is, in many other organizations, there's not a whole lot of clarity. There's not a whole lot of transparency on what the expectation is. When they're coming to Aptiva Health, they're getting a plan on day one. They're going to a provider that's going to listen to what their issues are. And we have X amount of people that are trained specifically for that issue. So for concussion, for example, they'll see one of our general practitioners. They say, hey, we might suspect concussion, or we've already been diagnosed with concussion. We have a neuropsychologist in Dr. Mandarino, again, one of the 35 fellows in the country that is trained specifically for treating that. She does her evaluation, has her treatment in line for them, which may involve me, a physical therapist for vestibular therapy. So again, they're getting ABC, everyone's speaking the same language. We're all on the same team and making and addressing that concussion or whatever it is they have going on. Just using concussion specifically.
Yeah, so once the patient comes to you guys, they get their assessment with Dr. Mandarino. She finds deficits. What are those deficits that she finds? Are they like visual deficits? Are they dizzy? Like, what are some things that you address back in therapy?
Sure thing. So from Dr. Mandarino's evaluation, she's looking for quite a few different things that are all treatable. From a vestibular therapy standpoint, I'm looking more for vestibular sensitivities, oculomotor sensitivities, migraines, even elevated stress and anxiety, mood irritability. Those are all symptoms that maybe some folks aren't aware that come with concussion, but are definitely present. In vestibular therapy, we have a multitude of treatments to address, especially the oculomotor and vestibular piece of things, to help address some of those other things that may come with.
So it sounds like once they get back to you, she's got a playlist basically of what she wants you to address, or I know we don't like to use the word protocol, so we call it a game plan. So she's got a game plan to send the patients back to you with. You touched on a point a little bit earlier where you said that what's different about Aptiva is that everybody's kind of on the same plan. Is that because you have access to people that other resources don't, that other entities don't? What's that multidisciplinary approach look like here, and how is that beneficial to the patients that you see?
I think what's really unique to, especially my situation here, me and Dr. Mandarino, we work under the same roof. She is right down the hallway from where I'm practicing my vestibular therapy and from where she's seeing her patients. So if we have a patient that we're both seeing, we're very collaborative in how we treat. So again, going back to her evaluation, she specializes in different treatments that a vestibular therapist may specialize in. So what she sees, again, she sends me with her recommendations, and then I'll do my evaluation. Might find something that coincides that maybe she may not have caught, and vice versa. So I think it's good to have more than one set of eyes on any one patient, and being able to have that collaboration and being able to communicate, literally just go right down the hall and talk to her about these things. It's been really helpful for my growth as a therapist and for the outcomes of our patients.
So it sounds like you guys collaborate really well on all these patients. Was there any special certification or anything that you got to train yourself on this vestibular stuff? Did you learn on the go? Like, tell me more about that.
Thanks. So when I was at my previous jobs, coming out of graduate school, you don't really learn a whole lot about niche things like concussion or even vestibular therapy. You think, okay, you treat someone who's dizzy, right? That scope only goes so far. So coming into the company back in 22, I've had experience treating some folks with vertigo, but it was very surface level knowledge. I thought it was, again, a good opportunity for me to kind of sharpen my skill set and just really push myself to learn something new, something I've dealt with in the past, having multiple concussions before. I thought it was really interesting to kind of dive into that world and see how I could provide for it. So once coming over, I participated in a 3-weekend vestibular certification course through IAMT, the Institute of Advanced Musculoskeletal Techniques. Again, 3 weekends, we went over concussion care, concussion management from a PT and an athletic trainer's perspective. We looked at vestibular therapy from a vertigo and other vestibular impairments perspective. And then on the third weekend, we put it all together and had a competency course. So 3 weekends, multiple hours of training, and again, repetition, being in this position. And again, along with all that, having Dr. Mandarino in-house. I mean, you look at all the research on concussion now, it's her name's on it, her colleagues' names are on it. What they're doing at the University of Pittsburgh Medical Center has been awesome to kind of follow along and learn from. Again, the resources we have, I mean, she's at the precipice of all of it.
Yeah, it sounds like it. And I think it wasn't too long ago that you had the opportunity to go to UPMC, Pittsburgh Medical Center, and was there a symposium that you guys went to? What was that like?
Yeah, so that was really eye-opening. It was more validating than anything, knowing that going back to, everyone here speaking the same language, everyone at the symposium, everyone that's presenting, everyone's speaking the same language. So again, it's more knowing, hey, these guys that are speaking, these girls that are speaking are at the forefront of all this research that's going into concussion care, CTE, all the big buzzwords you hear, especially surrounding sports like the NFL. You're having those people speak at this event, and you just get different perspectives on how to treat, and just knowing the recommendations we're already implementing here. These are the guys that are creating the literature, and we're doing this stuff every single day. So it's been really nice to know that, hey, our work is validated. Our work is not only results driven, but it's literature driven. It's set in evidence.
Mm-hmm. That's pretty cool. And I know Dr. Mandarino had mentioned that having this multidisciplinary approach and, as you said, everything under one roof has been really valuable. And she said that some of the patients she saw in the past, they had an ENT that they'd seen. They'd gone to see a PCP, a neuropsychologist that maybe didn't specialize in concussion, a neurologist. They're going to see their ophthalmologist, an optometrist. They've got 6 or 7 different people, and then adding in a therapist, a physical therapist. So you got all these pieces together, but they're all siloed out and they don't get one directive of care. So it sounds like what you guys are putting together here has been cutting edge. And obviously, I can see that from my perspective with the patients that you have that have gotten better that weren't getting those results at other locations. So one of the questions that I have is like, do you have a patient in mind or a patient or two or a scenario that you can kind of tell us about where somebody wasn't really getting better? They've dealt with this concussive issues. Like, can you kind of give us some insight into one of those scenarios and what that looked like for you guys?
Yeah, it's one that comes to mind as an elderly lady. She actually suffered a fall at home. Let's say this was, I maybe saw her in March of last year. She may have fallen in November of the year before. So it's been about almost 4.5 months that since the incident happened to when she saw me for the first time. She was dealing with dizziness, mood irritability. She's generally a pleasant lady, but she was, really short with her family members and didn't know why. Things like watching TV or scrolling through her phone were really bothersome for her, and she just really didn't have any answers. She saw her PCP. They, diagnosed with concussion, and you just get the same general message. It's like, no bright lights. Sleep in a dark room. Just try not to overexert yourself, essentially. Which is unfortunately a lot of folks come in with that advice, basically, and knowing from the research, it's not necessarily always so. So we treat her, we see her, and she's already come to me after seeing Dr. Mandarino with vestibular sensitivities, oculomotor sensitivities that we mentioned before. During my assessment, I was able to find, she had really stiff neck, as one does in their 60s after a fall. Other things, she also ended up having vertigo. So that's one of the things that I've been able to carve a good niche in for here, is oftentimes I've been seeing folks with concussion also having instances of what's called BPPV. If one of your family members ever mentions it, and, it's the type of vertigo you get when your crystals get all loose. So she'd never heard of it before, but she was really fearful for any type of movement, because anytime she would go down and take laundry out or tie her shoes, she would just start spinning and get really dizzy. So I was able to tease that out in my assessment. And once we were able to do the maneuver to fix that vertigo, that she immediately felt it's like a weight was off her shoulders. Now, granted, she still had some of the oculomotor deficiencies that come with concussion that were just undertrained, but just being able to screen out the vertigo, which no one to that point had really addressed, took a huge weight off her shoulders. I mean, we did the PT thing and did a few mobility exercises afterwards, and she was able to bend down, touch her toes. We were able to play catch, and this 60-plus-year-old lady is in tears, tears of joy, because she was able to go down, bend down, and she wasn't about to fall over. She said she hadn't had that in months and was afraid that she was going to be stuck like that the rest of her life. So after we kind of had that buy-in and we got rid of the vertigo, we were able to really go aggressively with her concussion care, which, again, 2 visits later, she was 98% better than what she was when she first came in. So it's just kind of a testament to how helpful this type of therapy could be, being able to recognize, these are symptoms that not everybody is aware can be treated, right? So just knowing that we can make that much of an impact in such short of a time is really rewarding for me. And that's just one of a lot of different cases over the last 2 years that we've been able to create that same result.
Yeah, as you said, that's got to be so validating, and it feels good when you're able to make that kind of an impact for a patient to the point that they're in tears because they thought they were going to have to live with this forever, and all of a sudden you guys gave them new life. That's pretty awesome. I wanted to highlight a couple of things you said. You mentioned BPPV, which is benign paroxysmal positional vertigo, and I might have gotten the P switch, but it's all those words combined.
Yeah, you got it right. That's it.
All right. And whenever that happens, you said something about the crystals in the ears. Can you break that down a little bit? Because, somebody who doesn't know about BPPV, they hear you say crystals in your head are misaligned. Like, what does that mean?
Yeah, so our inner ear, we have one on each side, inside just inside the eardrum for both ears. It's kind of like our body's gyroscope or our body's compass, if you will. It's basically a series of bony tunnels that acts. It just basically gives a. It's an organ that gives our brain a sense of direction, of up from down, left from right. The way those bony tunnels are shaped, they carry fluid in them, and when we turn our head one way or turn our head the other way, the fluid will flow through those tunnels, past some nerve cells that relay that message to the brain and tells us that we just moved our head. So the brain can tell the rest of the body to act accordingly. It's like, okay, if I turn my head, I'm not going to fall over. So within those tunnels, in certain parts of that apparatus, we have what are called otoconia. It's essentially, think of them like grains of sand, but just kind of made of bony material. They serve to protect those tunnels, those little canals in the inner ear. And sometimes, just like shingles on a roof can get blown off in a storm, head trauma, old age, those things can cause those otoconia to come loose. When those otoconia come loose, and it's okay that they do, but if they get dislodged in one of those canals that we mentioned before, it really just kind of throws the vestibular system off. What we should have is this pristine fluid flowing through the system, but now we have fluid with this debris flowing by where those nerve cells sense the movement, and that's when we get the spinning dizziness that is often tied to the positional vertigo.
I appreciate that explanation. That definitely makes a lot of sense, and I can see where when that system isn't working properly, somebody can't orient to north, and they don't know what's up from down, left, or right, and so they get all these weird sensations of feeling dizzy and nauseous, and other things. Um, Jared, you'd also mentioned something about the message that some people get about sitting in a dark room and not doing anything after a concussion. So what are some myths that you hear out there that you hear from patients that they were told in the past about concussion that's not accurate and up to date with what we know in research?
Well, having had many concussions myself, between football and snowboarding injuries in the past, even flag football most recently, a lot of it came from my mom. And it's just, you hear don't go to sleep after a concussion, you might not wake up. The Like you said, just kind of staying in a dark room, just people being held out from school or work for weeks at a time, and sometimes it's just the lack of follow up. Some people will see their PCP or be referred to a neurologist, and they come in, they see that your MRIs are clean or your CTs are clean, and I said, yeah, you have a concussion. We'll check back in like a month and a half, 2 months, and there's no real direction. Oftentimes people have come to me and it's like, yeah, that start to finish, that was their care. They went in, saw the specialist. I said, okay, you're not having a stroke, but you probably had a concussion. We'll see where it's at in a month or two. It's like, here's some dizziness medication. Here's some ibuprofen for the headaches. We'll see you in a month. So, I really think, not knowing any better, it's, what can you do? You're seeing a neurologist, you're seeing your doctors. Who are you to question, what their plan of care is for you if you've never encountered this before? So,
Yeah, sure. So I think one of the things you touched on was pretty valuable there, that it's not that these other providers don't know how to treat a concussion. They just haven't been taught the newest research. And so they're doing what they know is best for the patient, which is go rest, sit in a dark place, don't expose yourself to too much. So it sounds like you guys, in utilizing this exposure recover model, are having so much more success with people. And by exposure recover, I mean, you're getting them out there and you're challenging them with the things that are actually difficult for them to do. So, I think you had once referenced it as it's like building muscle. If you don't go to the gym and you don't stress that muscle tissue, it's not going to get any stronger. So similarly, after a concussion, if we don't stress the areas that you're having deficiencies, then we can't improve upon it. So that makes a lot of sense to me. I get that. What's some message that you'd want to share to the general public about concussion that you wish everybody knew and everybody was telling people about concussion?
I think the biggest thing is just, it becomes one of those buzzwords. It's it's real scary to a lot of people. They think concussion, I have brain damage, or they see incidents, especially in the NFL, where you have Tua and what's happened with him and his career so far, and we've had movies come out, Concussion, and you have other things outlining CTE. So you have all these things that kind of paint a very scary picture on what a concussion is, and what are the long-term effects. I think the biggest thing I want to kind of tell the public is it's very treatable. It's one of those things where if you have the right treatment, if you have a good course of action, it will get better, right? It's not the boogeyman. It's just another condition that with certain symptoms might keep you out from certain things, but it is something that can be rehabilitated.
Well, that's certainly super hopeful when it comes to concussion. Like you said, it can be a scary thing, and you've got all these multi-factors that come into play, these psychosocial factors that come into play, and you guys are giving them hope. So that's awesome.
I think just talking out loud. I think you made a great point about going back to what are the things that people might hear from their doctors or from family members about concussion. You touched on it a little bit, the expose recover model. Just as a PSA for folks out there that might suspect concussion or what have you, I think a lot of the advice comes from a good place, right? We want to minimize symptoms at the end of the day, right? We want people to not feel like their eyes are on fire, or like they're really dizzy for no reason. So a lot of these things are protective in what the advice is. But in terms of rehabbing from a concussion, it definitely needs to be that expose recover piece, right? We can never get used to light sensitive if we're always in the dark. We can never get used to going over and doing our laundry or washing the dishes or vacuuming our house if we're sitting still all day, right? Those are, it's going, like you said with the analogies, you can't get stronger if we're not kind of overloading the muscle to some degree. That's the same goes with our visual system and with our vestibular system. They need a little bit of a push to rehab.
So Jared, tell me real quick, when it comes to concussion care, what's the difference between getting treatment for your concussion at Aptiva Health versus another provider?
Yeah, I think we mentioned it before. It's very streamlined in our process. Someone with suspected concussion or confirmed concussion will see Dr. Mandarino. She'll do her evaluation and then refer out to the providers she feels are necessary in the care, whether it be a psychotherapist, whether it be a vestibular therapist, whether it be a general practitioner, if there's any musculoskeletal pain involved as well. She's kind of the quarterback in making those discernments. What I like about Aptiva is like I said, streamlined, but also there's very quick turnaround time. People aren't sitting, waiting on a referral for a month later. They're seeing Dr. Mandarino on Monday and then seeing me in vestibular therapy either Monday afternoon or Tuesday morning. It's not a month-long wait in between appointments to, the goal for this is to make sure someone gets better faster. And with all the providers we've had, we were able to do that. Just this past month, I was able to put on a continuing education course to train up all our physical therapists in the Louisville, Lexington, and Northern Kentucky areas in vestibular therapy. So it's not just me. There's all our physical therapists are proficient in being able to treat and understand the treatments that go into managing both vestibular rehab and concussion care. Like we mentioned earlier, the system works better when everyone's speaking the same language. Coming from Dr. Mandarino to the therapist to the psychotherapist, everyone on the same team they know what the other person's doing, and it really behooves the patient when you have a team like that taking care of their issues. Going on with streamlining the process and just kind of how there's, it's a fast turnaround between, getting your appointment with Dr. Mandarino and then getting the help you need after that. I think it fills a lot of different utilities. for depending on different patients. So you say you have an athlete that gets hurt in their game, Saturday morning or Friday night, whatever it may be. Our athletic trainers that we have in our team are able to make that recommendation or that referral same night, so they can be seen next day or that following Monday with Dr. Mandarino. They're not waiting a whole week. They're not losing a whole week of playtime, waiting for an appointment that may confirm or not confirm their concussion. So from an athlete's perspective, you want to know quickly, and we want to know how we can get this better quickly. There's no sitting on our hands waiting for an appointment to maybe get some advice on how to get back to the field faster. From that perspective, we also do the return to sport testing here with exit testing. Not only will you be seen by Dr. Mandarino, but again, you'll do a full physical clearance exam in conjunction with her recommendations with our vestibular therapist and therapy team, just to make sure with all the objective information possible that you are clear and able to go back to sport without re-injury or with very reduced risk of re-injury. Because at the same time that we want to rehab existing concussions, we want to do our best to prevent future concussions or second injury. From a overall outcomes perspective, so maybe not an athlete, but say someone who was in a car accident, we don't want that same situation like my patient that fell 4 months ago coming in with all these issues. If you have these issues on the onset, whether it be headache, dizziness, mood irritability, mood swings, the sooner you get it addressed, the less long-term these issues are going to be. If we let things fester and just kind of settle into our new normal, we have a harder time of rehabbing out of it. Again, anything's possible. We are able to rehab it, but outcomes are typically better the sooner you get on these types of conditions.
Yeah, so if you get diagnosed with a concussion, or if you have a concussion, you can call us at 502-909-0772 or look us up at www.aptivahealth.com. We also have a 24/7 Hurt app that you can download. You can talk to an orthopedist. You can set up an appointment through that app. So please, if you fear that you might have a concussion, or if somebody's talked to you about concussion, please use those resources to reach out.